More and more young adults are being diagnosed with colon cancer. That's according to a new study from the American Cancer Society. In fact, their research found 1 in 5 people are being diagnosed with colon cancer. They're younger than 55 years old. Joining me now is Dr. Pranshu Bansal and Dr. Anthony Pasquarella with Ironwood Cancer Centers. Good morning, gentlemen. Thanks for joining us.
Thank you for having us.
Wow, these statistics are really eye-opening and quite frightening, to be honest with you. So, doctor, let me start with you. Talk to me about colon cancer screening options and non-invasive tests. What do we need to know?
Yeah, so, as you rightly said, younger patients are being diagnosed with colon cancer now. But in general, with screening taking a bigger role in finding cancer at an earlier stage, in total, the cancer incidence has been going down over the last 15, 20 years because colonoscopy, which is the standard of care screening measure, has been able to detect precancerous polyps and remove them and also find cancer at an earlier stage.
Are there symptoms that we need to be looking out for?
So that's a great question, and a lot of the times, unfortunately, there are no symptoms. Patients tend to be asymptomatic. That's why it's so important that we're screening our patients, just as Dr. Bansal had mentioned. But some things to look out for, I just want to make a little disclaimer. A lot of these symptoms can overlap with non-cancerous or benign conditions. Okay. Some of those things can be if there's new changes to your stools, whether they're a newish shape, if there's increased frequency with your bowel movements, if there's new blood in your stools. Also, patients in their 5th to 6th decade of life, if they go to their primary care physician and they're getting their blood tests and they're newly anemic or iron deficient, that can be a tip-off. The least common symptom of all tends to be abdominal pain or abdominal symptoms. And typically, we don't see those symptoms until patients have a large enough tumor where they're causing obstruction in the colon. So that's really what we're really seeing.
So let's talk about treatments. If somebody is diagnosed with it, what are some of the new treatments and new surveillance techniques? Because I know Ironwood is state-of-the-art technology and medicine for their patients.
Yes, so the treatment options for early-stage colon cancers, which include stage 1, 2, and 3, this means cancer is still localized to the colon, are primary surgery. And then we use genetic testing now to find which patients may benefit from further chemotherapy, and also more genetic testing to find cancer at an earlier stage. In the past, we used to rely on just imaging, but now there are blood tests that look for circulating tumor DNAs, and that can find cancer at an earlier stage. So help decide adjuvant treatment after the surgery for stage 1, 2, and 3 colon cancers.
So are there new treatments and new things that can be done with someone who is diagnosed with colon cancer?
Yeah, so particularly for patients who have advanced colon cancer, we're still about 70 to 80% of the time using chemotherapy. But there are new exciting treatment options. We're in a time of personalized medicine and precision oncology, which we're now looking at the DNA of tumor specimens. And we're looking to see are there certain mutations that we could target, either with a pill or an infusion. The benefits of giving these targeted therapies is that we're able to spare our patients a lot of side effects that typically do come with chemotherapy.
And gentlemen, really quickly, before we go, if someone does not have a history of colon cancer, what age would you suggest start getting tested?
Definitely starting 50 if there is no family history of colon cancer. In African Americans, the ACP does suggest starting at the age of 40.
All right, 40 years old. Wow. Doctors, thank you so much for your time. We really appreciate you coming in and sharing your knowledge with us. And if you would like more information about Ironwood Cancer Centers, you can log on to their website or call the number on your screen.